Let's talk about fabrication of an implant-supported full denture. You can see these are before and after. And this woman had been like this for a long time with a horrible occlusion. Remember, when you're fabricating partials or dentures, occlusion is so important. That is one of, if not the fundamentals of my practice. Look at her vertical dimension. I increase vertical dimension a lot. Now, how do you know if someone has lost vertical dimension? Thin lips, downturned corners of the lips, horizontal lines in the face, a protruding chin. And this part of the mouth just looks compacted. So look at her face. Just look how much better she looks. This looks natural, and this looks squashed or compacted. The chin's too close to the nose. See the protruding chin when you've lost vertical? She's a little prognathic anyway, but looks a lot better after. You always want some tooth display with lips in repose. Now we're going to, as in this case, we talk about you can't always place 6 small diameter implants in the maxilla. Sometimes the bone is no good. I've had some cases I can only place 2. You'd like to have at least 2. 6 is ideal in the maxilla, but sometimes it's just not in the cards. You can't find good bone for a variety of reasons. We've got 4 in the mandible. Now this was her pre-op denture, and she was putting all this stuff in here to try to keep it in. I actually am to the point I won't make a denture, a mandibular denture, removable denture, without implants, just because I don't want to deal with it. So now we've already, in this session, we're talking just about fabrication of the dentures supported by small diameter implants. So I'm placing the housings on the implants. The implants have osseointegrated for 3 months. So these are the housings. You don't have to use shims for this part because we're going to take a custom tray impression. Numbing the back of the mouth with Hurricane. Then we're loading this with body polyether, and then this is polyether wash. Now I don't squirt any of the wash on the housings anymore. I pull the housings in the custom tray impression when I'm fabricating a denture. The reason I do that, the laboratory technician can use those housings from the beginning to fabricate an ideal base plate. So in the very first impression, go ahead and pull the housings, put them on the implants and pull them in the impression. So here's the housings captured in the polyether impression. Doing the same thing on the bottom. Now remember, when I show you how to pull the housings in the final denture with the hard acrylic, you have to use shims, those green shims. You don't have to use the green shims when you're pulling the housings in the custom polyether impressions. So here's the shims. You can see there's a little space between the housing and the gum tissue, and that's okay when you're taking the custom tray impression, because that's not going to lock in. Here again, custom tray, body polyether, wash polyether, keep the tip in the material so you don't incorporate air bubbles. I use these retractors for almost everything if I'm not using a rubber dam. It just makes it so much easier. Putting that to place and removing them, border molding. See here, I've pulled the housings in this impression. Now this is something that saved me a lot of time. I hate wax rim triants. I hate them. It just takes so long and they're so discombobulated. And I thought, I worked with my technician, I said, isn't there a better way to do this so the wax rim is close to ideal? Do you know what I'm talking about? It's just, I hate that. It's too unprecise. So what we're doing is we're taking a bite record, even if the vertical dimension is not ideal. I'm taking a bite record in centric relation along with a face bow and sending that to the laboratory technician prior to fabrication of the wax rim. So the wax rim is at least going to be in the universe of closeness. Sometimes it's right on, but it's always going to be a little bit close. Remember, if you take a occlusal registration record and you change the vertical dimension on the articulator after mounting it with that bite record, then the posterior part of either the night guard or the wax rim is going to contact first when you put it in the mouth. If you've changed the vertical on the articulator once you've mounted the model. So I know that's going to happen, but at least it gets us close. So this is just Almor Blue Bite Registration sheet wax. You heat it in a water bath, and then I'm going to roll it like this. Have the retractors in, place it in the mouth, and close the patient into centric relation at a reasonable vertical dimension. And then I'm going to squeeze that onto the tissue. If there's any areas that aren't in good contact, I'm going to squirt this Blue Mousse Fast Set in those areas. So it's not the most beautiful, but it's effective. And that'll stick to that blue wax. And then I'm going to take that out, and I'm going to use that bite record. I'm going to rinse it with cold water. I'm going to use that bite record to mount the case with this face bow. So this is her vertical dimension with lips in repose. So here come the wax rims back, and you can see this is really close. I'm going to put that to place, see if the lip position is correct, and also with the lips in repose, I want some tooth display. You always want some tooth display. You can refer to the article I wrote on lips in relation to incisal edges. I'm marking that with my wax spatula. Now the way I do wax rims, I get the upper wax rim perfect. I get it just perfect. And then I correct the lower wax rim to the upper wax rim. But I'm doing most of my work on my upper wax rim. So I want a nice incisal plane, and I want that to blend seamlessly into the occlusal plane so that it curves up like a horseshoe. You don't want the occlusal plane to curve down. You want it to be just a little bit of an upward slant from the center part of the incisal plane to the posterior part of the occlusal plane, a little bit of an upward curve. I want to get that right. Now, this is a good way to keep the wax rim, the base plate with the wax rim in the mouth. Once you've got the upper where you want it, squirt some of this Blue Mousse Fast Set polyvinyl siloxane into the area where the small diameter implants are located. Just a little bit, and put that to place and let it set, and that'll hold it in so it's not flopping around. Then I'm going to put the lower base plate in, and I've measured her vertical dimension in repose. Now the way you measure this in repose, you have the patient take a deep breath, there's no teeth, no wax rim in, put their lips together and hum, and have the lips lightly touching. Now that is the patient's vertical dimension when their teeth are apart, plus about 3 millimeters, meaning when the teeth are closed, that dimension is going to close about 3 millimeters. That's freeway space. Then with the teeth in, or the wax rims in, if it measured 60 when you're humming, lips together, teeth apart, when they close the wax rims of the teeth together, it should be about 57, about 3 millimeters less than that. So I'm adjusting this, here's my points, and I don't care if the lower wax rim is just perfect. I want the vertical dimension right, and I want it to touch on both sides, touch the upper wax rim on both sides, but I don't care if the front part of the lower wax rim is ideal, because I'm going to have my technician fabricate the teeth in wax to the upper wax rim that is ideal. But I want the wax rims to contact on both sides at the same time. See, so that's pretty good. And then I'm going to measure from here to the dot on the nose, and if it was 60, or say it was 70 when she was humming, that would represent lips together, teeth apart. Now the teeth or the wax rims are together, so that measurement should be approximately 67. So that's with the teeth together at 65, so with the teeth out, just humming, this measurement would be about 68, 67, 68. So now the wax rims are in. Now I'm sculpting the anterior part. Main thing is I want it to contact on both sides at the correct vertical dimension. Now I'm marking the midline, and then I'm cutting some grooves in the posterior part of the wax rim, so when we take a polyvinyl siloxane occlusal registration record, it's got something to lock into. Just a little wedge back there. Now I'm placing this polyvinyl siloxane back in the upper denture where the implants are to lock it in. So I've got the vertical dimension like I like it, where I want it. So I'm going to lock these in. I've got the lowers in, hold them in place, have the patient put their tongue in the back of their throat and close. Now when they put the tongue in the back of their throat and you're manipulating the mandible, the condyles go into centric relation, and then help them get the condyles into centric relation, because you want this to be a centric relation occlusal restoration record. And had them close together, mark the midline, bite record. Then the patient returns and we've got teeth in wax. And these are the housings that were pulled in the custom tray impression. The laboratory technician is using those when he fabricates the base plate to be sure you've got more than enough room for the housings. There's very few. I pull the housings in the operatory in my office when I seat the final denture. I don't have the lab process the housings into the denture. The reason I don't is because if anything is just a little bit off, that housing is not going to fit the implant. Or you may have a pivot point on one housing. If I pull the housings in the denture with hard acrylic, I know the housings are going to be perfect. The seat is going to be perfect. So if he's got the housings in the model as he fabricates the base plate, he can be sure that he's got more than enough room for those housings in the denture when I pull them in the office. I'll show you how we do that here in a minute. There's the upper. You can see we've cut this part out in the base plate. Same thing in the lower. These areas are cut out in the base plate for those housings. A good indication that the implants are solid, when you tap them and they go ting, ting, ting. If they go thud, thud, that one's not going to work. You might as well remove it and place another one. You want them to go ting, ting, ting. Okay, so I'm trying in teeth in wax. I'm going to lock those in again with just a little bit of the fast set polyvinyl siloxane. It doesn't take much. Checking to be sure this is aligned just like we want it when she smiles. Now in this case, the occlusion was off. She was too open in the back, in the posterior. So what I've done is just remove the lower posterior teeth and taken an occlusal registration record with the upper teeth are in wax and the lower anterior teeth are in wax, but I've removed the lower posterior teeth. And I'm just taking an occlusal registration record. Everything was okay on the right side. It was the left side that was in hyperocclusion, and I didn't want to deal with it in the office, so I just took those teeth out and going to have them reset. And you really don't need another try-in when you do that. If everything else is right, that's going to be very, very close when those teeth are reset. The patient approved the teeth in the wax try-in, and so we've processed the denture now. But I haven't processed the housings in the denture. The only time I process housings in a removable appliance is with a partial. The reason I do that is if you try to pull the housings with a partial, there are teeth in the mouth, and if that hard acrylic locks in around a tooth, it is not a good day. So I go ahead and take a chance with a partial, take very accurate impressions, and have the laboratory process those housings in the partial. But with full dentures, I never process them. I always have the lab process them. I always pull them in our office when I seat the final denture. I want more than enough room in the denture for the housing. I don't want it to those holes to fit the housing precisely. I want at least twice as much space as the housing is wide. So there's no question that the denture is seating completely. This is just the try-in, drying them. Now in this case, you must put these green shims on the small diameter implants so that there's no implant showing between the housing and the gum. If there is, guess what's going to happen? You're going to lock that denture in. So don't do that. You only do that one time in your life, and then you have to cut that denture off. So it's no big deal, but be sure that the shims take up the space between the housings and the gingival tissue when you're pulling the housings in the office. Cut these and want the tissue to blanch a little bit. So I want, when I put the housing to place, this tissue is going to blanch just a little bit, but that takes up all that space. So you can make the housing a little bit larger than the space, and it's going to be compressed when you put the housing to place. But see, there's no implant showing between the housing and the gum tissue. If you forget to put the shims on and there's implant showing, that hard acrylic is going to set on that implant portion, and it's going to lock in, and you will not be able to remove that denture. So don't do that. Remember, one of the nice things about small diameter implants is the alignment can be up to 30% off of the adjacent implant. They don't have to be perfectly parallel. So I'm trying the denture in on the housings, and I'm placing adhesive, and I'm going to use the hard acrylic pickup material, and I'm going to put the adhesive back here in the posterior area also. Not all over. I don't want to have the acrylic all over the palatal part, but I do want the hard acrylic in the area contacting the tissue where the teeth were, just to be sure I have a perfect seat. I'm going to put some here on the palette just in case some of the acrylic gets up there, and I'm going to place Vaseline where I don't want the pickup acrylic to stick. Then I'm putting just a little thin thread back here. I'm filling up the holes with the hard pickup material like that, putting it to place, letting that set. Then remove it after it sets appropriately. And here are the housings pulled with that hard pickup material. Then I'm going to trim this part. I'm going to do the same thing with the bottom. You don't want any implant showing. So, where I had just a little tip of implant showing, I placed some of this block-out material. Try it in, be sure it seats. This is the adhesive. Vaseline where I don't want the hard acrylic to stick. Again, I'm going to take this pickup material, just a little thin thread back here in the posterior region, even though there are no implants back there, to be sure the seat on the tissue is perfect. The implants don't support loading of the denture. That is supported by the soft tissue in the bone. You don't want the implants to be the thing that contacts when you push the denture down. If you do, it'll fracture right there. You don't want them to pivot on the implants. All you want the implants to do is to prevent horizontal and vertical upward movement. But when the patient loads the denture, you want that load to be on the soft tissue in the bone, not on the implants. So this way I'm positive when I seat the denture that load, vertical load, is on the soft tissue in the bone and not the implants. This way you know it's perfect. So put that to place, and I hold it with my fingers. I don't have the patient bite down, because if anything teetered just a little bit, it'd be off. When I hold it with my fingers, I know it's seated perfectly. Then we'll adjust the occlusion once the acrylic is set and the housings are pulled on the upper and lower dentures. And this is just a Brasileir acrylic burr, and I'm removing any of the excess acrylic that's covering the housing. Doesn't take long, and any sharp spots. But this is a quick procedure. You don't want to remove this interproximal acrylic, because I want the tissue to contact right there so that the denture is supported vertically when you load the denture by the soft tissue and the bone. I'm just removing any little sharp areas. Okay, and I'm polishing where the frenum is right there. Now I'm polishing with pumice on a rag wheel, pumice and water, and just cleaning everything out. Check the occlusion. So what occlusion am I looking for? I'd like the teeth to contact in centric relations in the cuspid, bicuspid, and mesial, the first molar area. I don't want the patient pivoting off the second molar, and I don't want the 4 incisor teeth to contact first. I want the contacts in centric relation to be cuspid to mesial of first molar. This is just a occlusal adjustment burr on a slow speed handpiece. You see that contact was on the second molar teeth, and so I adjust until I've got contacts on the side. See how the incisal edges are a little bit different. I'm trying to make these dentures look like natural teeth, to the point when we get through with a case, I tell patients to tell their friends and family when they say, "Have you done something to your teeth?" say veneers, because these should look like a very well done porcelain veneer case. We don't use the cheap plastic teeth. This is a hybrid tooth that looks so natural. There's lots of light refraction and reflection and translucency, and they look like natural teeth. And then when we're doing the teeth in wax, we change them just a little bit so they're straight, but they look like natural teeth. If there's any sore spots, we use this pressure indicating paste. And I have her bite down on cotton rolls on each side, and you can see there's just a little rub right there. And there we have it. Lips in repose. With her previous denture, she had no tooth display with lips in repose. You always want some tooth display with lips in repose. Smile, profile, previous dentures, new dentures. And that's the Dental Minute.
Hey guys, thank you so much for tuning in to this episode of the Dental Minute. Make sure you press subscribe right there if you're not subscribed already, and get fired up because next week we are talking about seating anterior bridge and crowns. It's going to be amazing. We'll see you next week.